Good morning. I am Editta Buttura da Prato, Italian maxillofacial surgeon. So my session was about rejuvenation and prejuvenation. These are two different approaches that now are needed to be included in our daily practice. I mean that prejuvenation is a new trend that is upcoming and somehow a controversial topic because the age of the patient will become younger and younger, and this new generation has different values. I mean that their values are founded in another era and in another period. So from other generation, they are different, and the approach we have and the treatment we can propose need to be different and set on their expectation and real needs. All the speakers brought their own experience and point of view, and I was happy to have an international speaker group starting from the Italian reality. So Paolo Casti, together with me, was highlighting the characteristic of the Z generation, that is this new market target for aesthetic medicine, but need to be set in an ethical point of view in our practice, and there is the need to understand what they want and why they desire to put some aesthetic treatment on their faces, and they choose to refer themselves to practitioner in aesthetic fields. Then was the time for me, and I was highlighting which is my approach, and I show some cases of patients that are young and need a treatment because they have a diagnosis, something like masseter hypertrophy, gummy smile, or chin impairment, or hypogenia. I mean very low development of the lower third. Now these young patients are really aware of their defect because they look at themselves in a different way from the way we were looking at ourselves, and different from our grandfathers. So it's important that they have a proper diagnosis and they have a proper treatment, but avoiding over-treatment and avoiding addiction, but mostly avoiding to be enhanced on their dysmorphophobia or selfie dysmorphia. Then Erminio Mastroluca, that is an aesthetic surgeon from Italy, was highlighting how the perception of the patient, he was focusing mostly on male patient, is different according to the cultural background of the different patient he's treating. So the perception of a jawline can be different, or a perception of a nose can be different. And the main goal of a doctor, of a practitioner, has to be to set the real needs of the patient. Maria Grazia Patalano from Sicily, plastic surgeon, was highlighting the need to match the real needs of the patient with the treatment. So I mean that sometimes these young patients are asking for some procedures, but we have, as doctor, to verify and to educate our patient in the meaning that we need to explain them if their needs, their wants are real, what we can treat for them. And sometimes we realize that they see something wrong in a part of the face, but then the problem to be treated is in another side. So maybe the masseter hypertrophy has to be treated to reshape all the face. Hugh Cartier, as a vice president of IMCAS France, is a dermatologist and was highlighting the need for combination therapy, and according to the different age and diagnosis, maybe in the dermatologic field, there is the need to change the combination or the path of the patient. And Beatrice Molina from UK was focusing on the loyalty programs that she is proposing in her office. I mean, she has patients that are treated since 15, 20 years, and the loyalty is built on results. But results need to be educated. So we have to change our setting expectation on the patient from wow results in one session to a regenerative path that is life-lasting, long life-lasting. And I think that both of them gave us the possibility to give a nice point of view, a very interesting point of view on very young patient. Hugh Cartier is the co-author of different publications on prejuvenation trend, and to take them to the loyalty and to the trust that is making the patient coming back with different needs, different ages. So, as was emerging from the session and on an international point of view, the trend, the mega trend is that prejuvenation is a real fact. So our patient will be younger, the Z generation will step in our offices and will ask for procedures. So this is a real trend. Our trend has to be based on pillars that are ethics, combinations, and analysis. And we have to remember that we have to care first. So as doctors, as healthcare practitioners, we have to take care of the patient, of their faces and on the healthy faces. I mean that every procedure that we have to perform on patient has to be capitalized, like put in the bank for the future years of aging. So every intervention has to be planned smartly and in a clever way. I think that the main consideration we can have is that also thanks to the international interviews we have and international lecture, we could have a very diagonal overview, starting from the Italian data, our reality, our daily life. We could explore also other countries like NFIS for the Gulf area, or Hema Sundaram was bringing her North American experience, European experience, and we could appreciate all the point of view. But the final cut is that all of us is agreeing on strong ethical basement and on regenerative paths. I mean that fillers and lasers and energy-based device anyway are basic aesthetic medicine, but now we are more toward a regenerative medicine that is the one that maybe is the starting point also for the new young generation. Thank you.